Again, some very difficult news in New South Wales today, and our sincere condolences and sympathies to the families of those who have lost their lives in the COVID pandemic. And so on a difficult day like this, it's important to bring hope. And I can assure you there is hope. There are 4 million reasons to be hopeful today. Because the government has been able to secure with the government of the United Kingdom a Pfizer swap deal, which will see 4 million doses of Pfizer come to Australia this month. The plane's on the tarmac now. We'll be leaving tomorrow, and those doses will be coming over the course of the next few weeks, which will see us double the Pfizer doses that we have during September. This means from Downing Street to Down Under, we are doubling down on what the Pfizer doses are here in Australia this month. This will enable us to bring forward significantly the opportunity for Australia to open up again under the national plan. The bring forward of these doses, I think, should be a great cause for hope right around the country. The doses will be distributed across the states and territories on a per capita basis so they can all get on with it. Whether it's in the GP clinics, with the GPs, or in the state-based hubs, they will be able to move forward and see these doses get into arms and get Australians back to where we want to be, living with this virus as soon as we possibly can. I want to thank very, very much Prime Minister Johnson, who he and I started discussing this some time ago. I want to thank him for his personal commitment to this and his great friendship with Australia. I want to thank also Health Minister Sajid Javid, who I've known for some time, and he's coming into that portfolio in recent times, and the ability to progress this with Greg Hunt, our Minister, and I want to thank Greg and all of his team. There's been some very late nights of discussions, negotiations, legal work that has been taking place, particularly over the course of the past week, to bring this to conclusion. But it has been the real commitment to Australia from Prime Minister Johnson and Minister Javid that has seen this through. Can I thank Minister Payne as well for her great work on all of this, as indeed with the Singapore arrangement and the Polish arrangement. DFAT have really been earning their keep when it comes to delivering on these arrangements. Our High Commissioner, George Brandis, who I've been in regular contact with, as has the Health Minister, indeed the Secretary of Health, Brendan Murphy, and that has been an extraordinary cooperative arrangement that has saw this come to bear over the course of these many weeks we've been seeking to secure this arrangement. So when you put it together, the extra 4 million from the UK brought forward, the extra 500,000 we were able to announce earlier this week, the 1 million and more that has come from Poland. All of this, I said I would leave no stone unturned, and I can tell you I've been turning over some stones in recent times to ensure that we can progress the vaccination program as quickly as we possibly can. And it will now build on what is a very strong performance. We are now at the point where 80% of over 50s have had their first dose. 80% of over 50s, drawing through to a second dose in the weeks that are ahead. 20.3 million doses now having been delivered. More than 10 million of those have been AstraZeneca, I want to stress. I want to continue to encourage everyone to keep going and getting their AstraZeneca jabs, particularly those who are over the age of 60. That is the recommended vaccine for over 60s. And so I want to encourage you to go and get your second dose as well. And let's keep this going, Australia, because at these rates, we are really going to be able to hit the marks that we all want to hit in the weeks and months that are ahead. I want to thank the states for their support for the national plan that this vaccination program underpins. The Victorian government, the New South Wales government, Tasmanian government. I was speaking to Premier Gutwin this morning, and I can tell you he's feeling much better, and he's coming back to work now and recovered from his health issues earlier throughout the course of this week. And while Peter won't be with us this afternoon, we've had a good discussion through the issues that will come up at National Cabinet later today. I also want to thank the South Australian government as well, where we're doing the home-based quarantine trial. We'll continue to work with all the states on the plan that we've agreed to ensure that Australians can have hope in the future. And these 4 million doses of hope today, I think, will only give us further encouragement. And this afternoon at National Cabinet, we will have the opportunity to discuss through a number of measures. We will talk further through with Professor McVernon the continued sensitivity analysis that she conducts, and there will be opportunity for all premiers and chief ministers, as there has been now on several occasions, to continue to work through that analysis and advice that has come from the Doherty Institute, and to ensure that they fully understand it and that they fully understand the various things that need to be managed as we move into Phase B and Phase C of the plan. We'll be talking through, as always, where we think we'll be able to be on public health social measures when we move in Phase B and Phase C. There's still work to be done there, so this afternoon's discussion on that will be important. The other issue that, of course, we'll be talking about is Professor Murphy's, and by the way, congratulations, Father of the Year, Professor Murphy. I think he's often been seen as the father figure in many ways from this platform. I hope I haven't broken some secret here. But anyway, if I have, there you go. Congratulations, congratulations, Professor Murphy, Father of the Year. And Jenny said to say congratulations too. I haven't been able to pass that on to you yet. But this afternoon, he's doing a very important work on the hospital systems and public health systems capacities right across the states and territories. This has been being done for months, but now with the benefit of the Doherty work and looking at the peak demands that are going to come in our system, the flexibility that we'll need, how resources can be moved, workforce managed and so on. That was a key item of discussion between myself and Premiers Andrews and Berejiklian this week, where obviously the pressure is coming most soon. In terms of the outbreak in both of those states as we're moving into Phase B and Phase C. I'll come back to my discussion with President Biden but after others have spoken, but we did have a very warm and friendly conversation today, and it was important, particularly this week in marking the 70th anniversary of ANZUS, but also to talk through the very important issues of next steps in Afghanistan and other issues here in the Indo-Pacific.